Welcome to the last section of this course for sports psychology. And this goes down in terms of what we've kind of been leading up to the whole time in terms of quality of life. We've talked about this in almost every chapter about how, diminishing anxiety, diminishing stress, diminishing depression, all of those things that we've talked about as we've gone through, how by moving those in a downward motion while increasing our exercise has really opened our eyes to really paying attention to how that increases our quality of life. So we have to pay attention to that to really understand, okay, well, what are we really doing? Exercise is great, but if you don't understand why and what it's leading to, and I mean, look at a retired football player, for example. There's many examples of these athletes who get done working, in a sport for their job, and what they do is they go to living a life that they had post, athletic career, and you see a lot of them gain weight or, get unhealthy in some way or body composition changes or whatever. And then on the other hand, you see some of them that can maintain some sort of a physique that is maybe not comparable to their athletic days, but they're still very, very fit and well. Okay, so you have to think about those because they lived a very rigorous athletic life, and then post, career, they're really having a problem maintaining just being able to stay fit. So we have to look at it from all those perspectives, and just because you were an athlete, does not mean it translates to the rest of your life that you're just going to naturally keep those genetics and keep that fit life unless you do something about it. So that's just one example. So let's just talk about quality of life in general first. All right. So what is quality of life? It's both subjective and objective evaluations of the goodness of one's overall life. So really, if we looked at it, it's how well you are living or how well you have lived and are going to live. All right. That's really all about quality of life. You're trying to enhance quality of life as you go through your life cycles. Okay. Then there's what we call health-related quality of life, and this goes into a little bit more detail of the goodness of those dimensions of life that can be affected by health or by health interventions. Okay, all dimensions of life that are enhanced via ways of, our own way of improving health, and then those ways that we use our improvements or we make those gains and those strides toward a better health overall. Okay. And then if we look at everything there, and physical functioning, that's part of it. Overall health, emotional well-being, social functioning, cognitive functioning. If we look at it from that perspective, we can also go into, quality of life. We can also, if we were to pull it up into Google, if we just went, 7 dimensions of wellness, all right, and we kind of just paid attention to that, 7 dimensions or 7 domains, whatever way you want to look at it, we can pull that up right here, and you can see that to be well, all right, to be well, we're really looking at it from the standpoint of, occupational, environmental, physical, intellectual, emotional, social, spiritual. All those define us as being well, all right, and that relates directly to our health, our quality of life, our health-related quality of life and being well, right? So they do kind of pair each other very well, all right? When we talk about the aspects or the dimensions of, so just kind of a comparison aspect. So if we were to take it, we could actually, kind of put it into this perspective here and really make it so that it fits into, if we can actually get it to work. There we go. Where we can see that it works directly hand in hand with everything that we have, all right? So that's how we look at it from that standpoint and really paying attention to, well, what is it that we're, trying to do here is that we're trying to make ourselves more well, and by being more well leads to a better quality of life, okay? So as we move forward and through, let's just kind of blow this up. Here's more, and this is a little bit more of the breakdown for this course in particular, but this is the dimensions of quality of life that we want to pay attention to in terms of psychological, the social aspect, the physical health part, and then the environmental. And you can see all of the aspects that come from that, all right? This was actually developed by the World Health Organization, or the WHO, all right? And they basically created this so that you can see all of those different areas and where you can improve upon or where you can keep yourself going in the right direction. Okay. So really when we look at this too, they are independent factors, but ultimately what we're saying here is that, through these independent factors of psychological, social, environmental, and physical, they all work together in unison to give us this goodness or this wholeness of our life. Okay. So, with psychological, it's all about, how we use positive feelings, how we work with negative feelings. What's our self-esteem like? How do we perceive our body? All right. Physical, are we mobile? That's one of the things I think we kind of underestimate is that flexibility and that mobility, and how we underestimate that as a very good quality of life. Okay. Social, we're talking about relationships, all right, whether it be social, sexual, or personal. All right. And then environmental factors, there we go. Look at all the, health and social care, financial stability. Are you satisfied at work? Do you do anything for recreation or leisure? How do you work with transport? Like, are you taking public transportation, etc.? You never know. Okay, so those are parts of it that we're working with. And that overall aspect, all of these positives here, or all of these things we have to work with, that's going to define our quality of life or improvements in quality of life. All right, but why is it important to us? Well, really, we're using this as a way to look and see how, as an exercise scientist, exercise specialist, we're looking to this to kind of guide us in the right directions. All right, so if quality of life is down, all right, then ultimately what's happening is we have to be able to improve that quality of life. So therefore we have a gauge to be able to show improvements and then to know how to prescribe appropriate exercise effectiveness so that we can basically make these people better movers, feel better, act better, socialize better, all right, all the things that come with that. Okay, and that's really why it's important. All right, so what do we do in terms of measurement? All right, well, when we measure from an objective standpoint, okay, objectively, we have to think about it as, remember, subjective is more about from the eyes of the beholder or the person who is being in charge, and that's taking control of their own life. So objective approaches are created by another person. They are definitely measurable, and being measurable makes them more objective in that way, because we know that if, like it says there, a number of pounds a person can bench press. If you can bench press 150 pounds, that's an objective number. That is not subjective, right? It's not opinionated. It doesn't have any bias to it. If you put 150 pounds on a bar and put it down to your chest and lifted it back up, we know that that person could lift 150 pounds. Now, if they weighed 150 pounds, then we're talking about they're being able to bench their body weight, and that's very appropriate. Okay. And then lastly, with these objective approaches, we can actually determine what we would call our quality adjusted life years. Okay. And there, like it says right here, you can calculate a numeric, wow. You can calculate a numeric value to indicate the quality of one's remaining years of life. Right now, that is a little more challenging, but we can still do that based on specific factors. Okay. The other thing we can kind of, and I'm going to kind of add a little bit to this from my own, you can also have what we would call, and this is kind of like, it's just another way of measurement is what we would call your exercise life, and that's years of total exercise. And that's one thing that we can also work around too is, training life, training years, whatever it may be. Those are just things that we can work with. And I think sometimes those are also very objective, because if you're 35 years old and your training life is 23, that means that you've been working out since you were 12 years old. That's highly appropriate, right? But we also know that as you age, things change. So, and as you get older, your ability level and your motivation may be high, but what you can actually physically do really, really makes a big difference here. Okay, and it really shows us that as you get older, you can't do certain things because your body just can't do it. Okay, so Also, in looking at something here, what we can look at in terms of this QA, the QALY, there's actually a physical, like it's kind of like, it's not like a survey, but what it is you look at it and you see, okay, well, where is my, do I have any health problems? All right, and then from there, you're looking at the evaluation component of it, and what we're seeing is that, it's really describing your own health state. So if you had no problems in your life, you're basically a 1. Okay, and then from there you go down based on what kind of problems you have. Like for example, if you have a person who has no problems walking, they have no problems with self-care, they have some problems with performing usual activities, they have some pain or discomfort, or they're not anxious or depressed, they have a range score of maybe like what we would call a 0.76, so like a 3/4 rating. Okay, and what this does is it kind of gives you an idea as to, okay, where their life expectancy is going. Okay, so when we look at that, it kind of gives us a better representation as to where we're at. Now, this was taken from, it's called What is a QALY? All right, and this was created by Phillips. All right, and you can basically go through here and you can see that there's a lot of things that are out there that are adapted based off of that. All right, and it kind of gives you this series of approaches that we can use for that. Okay, and now if we just clicked on something here, and in terms of an article, it'll give us a really good idea as to our life expectancy, because it is kind of like an like an algorithm in some way. And you can buy things from there. You can look at certain articles. Like this is actually in ResearchGate, so you can see this is actually from the author, and you can see here that they kind of go into certain things, like in terms of the article itself. If we were to actually download it and look at it, we can determine, really where we're at in those aspects. Okay. And it kind of goes through and, quality adjusted life year, takes into account both quantity and quality of life. So that's awesome. All right. But as you scroll through, it gives you the concepts behind it. What is quality of life? Talks about calculating it. All right. And then, showing you, intervention strategies, keep going through here. It talks about what we call cost utility ratio, and it dependent upon what your intervention strategies are. And then this is what is actually in the text right here. This is what I was referring to before, and this can kind of give us a good idea as to, our valuations and see where we're at. Now, like I said, if you look down here, bedridden, unable to wash or dress themselves, you can see here that's a negative score, all right? And that's kind of what I was getting, into when I talked about this one right here. This was the one I just kind of hit on. Wow, it didn't highlight the right way. This was the one I was kind of explaining to you before about being a 0.76, so about like a 3/4, all right? And that kind of just gives us that good indicator to where we're at. Okay. So other things that we can do from a subjective standpoint, so again, from the opinion of our people, okay, like it says here, in terms of measuring our health-related quality of life, all right, we really want to pay attention to, like things like perceived levels of functioning is one of them, all right. This is more of a generic measure, and what it is it's more about, what have you been experiencing over time? Is it messing with your day-to-day operations? And you can kind of get an idea as to how much it's getting from you. Then there's other things like satisfaction with functioning, and this is right here the example, which is the life satisfaction scale. All right, so if we blow that up a little bit, you can see here, these are sample items that we could talk about, but how satisfactory are these different aspects of your life? How is your family life? Okay. How is your family life? You can kind of answer that question. What's your physical health like? What's your psychological health? What is your contacts? How satisfactory are your contacts and, with your friends and your acquaintances? How satisfactory is your ability to manage your self-care? Can you actually take care of yourself? All right. And then, basically how satisfactory is your life as a whole? And what it is, it's a rating scale from a 1 to 6, kind of like a Likert scale, and you're kind of giving a number to what you're saying. Now that, again, is from you, or you as the person. So you're the one that, so that's why it's subjective. But, if you're a 6 on all these, then, I mean, we're really, that means you're pretty satisfied and can show that you can take care of yourself in both mental, physical, care wise, overall well-being wise. So there's a lot of things that come with that. Okay. So when it comes to that, well, that's great and all, but which one's better? Well, from my perspective, you really need to give credit to both of them, because not only do you want to see it objectively, but you also want to have these people experience it and then live it and then, gauge for themselves how they feel as well. So if you see a big disconnect between the objective numbers that you're trying to achieve through physical activity and a subjective measure through, these people saying that they can move well and they live well, but really they are not showing it, then ultimately you're kind of, then that's where that mixed feel is. But that's where you could say, okay, well, the objective nature is more appropriate for that, because these people are really not self-reporting very well. So that's just kind of some things to think about. All right. So when we go to the research part of everything, all right, there's some evidence that we can see from research that's out in the world right now, okay, that exercise can obviously improve our health-related quality of life, not just for those that are sick, but obviously keeping those who are healthy, healthier, okay? Those people who have health compromising conditions, we can make improvements to that. And then specific populations, those with cancer, those who are pregnant, those who have diabetes, we can see that exercise can help them, in those specialized those populations that we can enhance. All right. So what are the dimensions that are most likely to be affected by our exercise? Well, physical functioning, obviously. So with improved physical functioning comes more of a greater health status, a better health status. It helps, we talked about it before with anxiety, stress, depression, all that stuff. We create a better emotional state. And from there, when we feel better about ourselves, we see that we are, in terms of like self-image, we see that we're better with ourselves. Then we want to be more social and interact more. And then from there, we also know that cognitive functioning improves from there as well. Okay. So those are those factors that are really heavily influenced. Now, some that might be influenced here, that are going to, factors that are going to, really play their hand is the purpose of the exercise intervention. Well, why are we doing it? Well, that really becomes a big deal, right? If you can figure out the purpose or the why, then really we can start making bigger strides in these individuals' well-being and the quality of life they have. We also want to see here the perceived value of, the dimensions within health-related quality of life. Okay. So we want to make sure that we're looking at how much we value those things, like the psychological, the physical, the environmental, the social. Okay. And then the inclusion with other and, health-related quality of life enhancing interventions. So what, besides the dimensions, what is it that we're going to do to make people feel better, move better, live better, better quality of life? Okay. And those factors will really be a greater impact on individuals, and it really help them to, again, take care of those social parts, those environmental parts, the physical parts, and the psychological parts. All right. So what are we looking at here in terms of like how do things change? Well, ultimately, if you look right here at this diagram, it's pretty straightforward. Exercise, but if we looked at it from the standpoint of both exercise and physical, not just exercise, but physical activity as well, based on, ability levels of individuals, exercise and physical activity improve self-efficacy. And remember, self-efficacy is that feeling that you are able to achieve something. So with greater demand for, or greater improvements in self-efficacy, we can see that we then get, better improvements in our physical functioning, therefore, changing or improving our dimensions that we talked about, okay? One of them, for example, being perceived physical function, how you see yourself being able to move, okay? And that's really, really critical for healthy people get this and they understand it, and that's why they're constantly striving for more and getting, providing that overload to be able to improve their own health even greater than potentially what it is. Right now, of course, we hit those genetic limits, but they're still striving for better, striving for greatness. Okay, whereas those who need the assistance because maybe they're, you know, obviously in need of the change, exercise will improve their ability or feelings of their ability levels, which will then ultimately trickle down to eventually leading to one way or the other feeling good about their social, relationships. They might be feeling better about how they feel psychologically with emotions and moods, all right, and being able to concentrate more. Maybe their job is demanding in that way. So you can see it just helps all around, okay? So, again, looking at these mechanisms for change, you have things like it says here, quality exercise participation experiences. So really what you're getting here is what we want to think about is this overall accumulation of over time. It's not just going to happen. It can happen in that first bout of exercise, but ultimately what we're saying here is that it's an accumulation of all these experiences that have come together that create, autonomy. Okay. We have those feelings of belonging, and that's pretty straightforward. I just want to make sure that, for clarification purposes, when we look at the term autonomy, what we're saying is, being able to, with autonomy, it's your independence in some way, that you can act alone and still be able to do it in that manner where you're able to take care of yourself. All right. Belongingness, feeling of belonging, there's that challenge that's there. With experiences comes challenge, and when you can achieve, when you can beat those challenges, that means that you're going to feel better about it potentially. You're engaging, and then obviously, with physical activity, there's that mastery. You went from being able to do little to nothing to now being able to do that exponentially higher, all right? And then therefore, all of those things, in terms of autonomy, belongingness, challenge, engagement, and mastery, ultimately will help to increase your health-related quality of life, all right? But that's just using exercise as that tool, okay? And saying that, if you participate in exercise, the experiences that you're going to get from that participation are going to change who you are in many different ways, that it's a culminating effect of many different things. All right. So when we look at it from a visual perspective, there's your physical environment, your activities, your social environment. There's, with those, we lead them to the elements of quality experiences, like it says, autonomy, belongingness, challenge, engagement, mastery, and meaning. Now, all of those individual quality experiences will lead to quality participation and then ultimately an improved health-related quality of life in all of those, those domains, such as, again, psychological, physical health, social relationships, and then the environment, okay? But if we can take those make improvements in the conditions that we have, that will enhance the elements that create better experiences, which we will then produce higher participation levels, therefore increasing our exercise needs. And then eventually that leads to that quality of life. And that's taking what we said here and putting it into that visual representation so we have a better understanding as to what we're looking at, okay? It's really a great thing because when you're looking at this image here in particular, you can see these changes. One of the greatest examples I love is when you get that person who has they may still be a little bit out of shape, but I had a client, a gentleman way back in the day, that he actually started feeling so good about himself that you could see that he was wearing, every time he came to work out, he bought new clothes, he bought new shoes. He didn't have, the old ratty shoes that he had, because now he was starting to take, and this is a gentleman who was, very affluent, had, was very, very wealthy, but he just never took care of himself because he actually, his wealth didn't really translate well to how he took care of himself. But then when he comes in and starts seeing me as the strength coach or the trainer, whatever you want to call it, he actually started making these improvements, and you could see that he started to feel the challenge. He started to feel engaged. He started developing that mastery because he was moving better. And then he found that meaning. And then when he found that, he started coming in every day with nicer clothes. He started to, his hair, he got a haircut, came in with a nice presentation, and he just, every time he came in, he was more well kept than he was before. But that's all part of that quality of life. He's feeling better and moving better, appreciates things a little bit more outside of just working out, and he's taking care of himself more in more ways than one. And that's improved health-related quality of life. And that's what we want to see in our people who really need that change. Okay? So what do we need to do in terms of recommendations? How do we enhance for these individuals? Well, it must be able to perceive improvements. What you're doing must be able to show that there's going to be, or that there's a willingness that improvements will occur. Okay? There is the value of exercise to an individual's health-related quality of life. They have to show that there's a value to why they're exercising. People hate exercising, but if you can show them the value to it and then they can start feeling that value, that's going to make the change. All right? And then encourage various types of movement. Don't just stay in one rut, because if you expose them to many different things, then ultimately what they do is they have an appreciation for more, and therefore they're more able to do more things, which opens up their Pandora's box for, just having a better quality of life and feeling better in general. Okay? So then, what are we doing in terms of like special populations? Well, we want to make sure that these interventions overcome specific barriers like fatigue, like pain, depending upon what's causing the issues with an individual. We're trying to avoid symptom flare-ups. All right, trying to change that feeling of depression. Especially when you don't feel good, you are depressed. So we're trying to get them to feel better, but also remove that depression from how they feel. Try to get them to engage more, so that that lack of motivation and self-confidence can be changed. By educating them, we can remove that lack of knowledge. By being, friendly to them and cordial and showing that you care can help with that social support, which then translates for them to be able to go out and do it in the real world. All right? Make them understand that access doesn't mean that you're just going to a gym. You can go to a park. You can go to a football field. You can go to the beach. There's many different things, especially for us that live down here in Florida. We have access to a lot of different beaches depending upon where we live. So access is always there. Weather might not always be conducive, but you know what though? I live in Florida now, but I came from Connecticut, and access didn't mean that I couldn't go out in the cold or enjoy the snow or things like that. And it's the way it is. And then also, these people don't feel well. Sometimes the healthcare coverage isn't there. Well, getting them to move, we talked about exercise as medicine. All right. And that can help with these individuals. By helping them move can be a form of medication for them. Okay. So those are just, things that we're looking for recommendation purposes to make them feel better. All right. So so what do we want to be? We want to be a little bit more informational. Okay. There's that education piece. Okay, we want to be more behavioral. We want to be able to go back to that, that calm B back in, chapter 5, and look at it from the standpoint that we're trying to overcome barriers. We're trying to take away that, those lapses that might occur. The social part, understanding, that, there is support no matter where these individuals go to overcome these barriers, and then also understand with the environmental component that. The accessibility is always there for many different things, and we always have to strive to show individuals that, because we want to have them overcome barriers. Now, we talked about the environmental part of it, but we can also try to, like I said in the last slide, we can just try to show them that everything is available to them, no matter if it's nature or built. Okay. So here's the thing that, and I left this one up here because I really felt like it was necessary, because it is a good issue for debate, but health insurance companies and government-funded healthcare systems routinely cover the cost of drugs to treat many chronic health conditions. I think you know where this is going. Well, for that last bullet, why aren't they recognizing exercise as a treatment, so that insurance or government-funded health can, these government-funded health, care systems that provide funding, why aren't they, covering the cost for exercise, gym memberships, for equipment, for trainers, other associated costs that come with it? Why are we not taking care of that? Why is that not part of it? Is exercise really that much of a threat to prescription drugs? I mean, me personally, yes, I do think that is the case. I feel as though that, exercise is and we've seen it all throughout this whole course, is that exercise is a viable option to drugs for many different things. All right. So why are we not able to fulfill that need for people who really truly need it? Okay. So just a really good food for thought kind of a moment here. All right. So again, take all of this, understand that all those things that we talked about throughout this whole chapter, well, not just the whole chapter, the whole class, whether it's specific emotions, moods, mood states, well-being, quality of life is the ultimate goal. And going back to that football player who is now post-career and doesn't understand, well, that individual there, he's looking at all these barriers. And a lot of it is the informational and the behavioral that individual is going to work with, because they're so used to being told kind of how to do everything, how to, they're coached on everything, how to train, how to eat, how to live. And now they have to do it all on their own. And it's like, oh God, I just came from and in some ways sport is militant because you always are being drilled with task. Okay. So not to say that that's a bad thing, but when you get out of that, you're like, now what? You got to figure it out on your own. So, that individual who is highly functioning still can suffer and lose quality of life, but we can always help them to regain that. Okay. So just, again, some things to think about as we move forward from this course. So I hope everybody really enjoyed the lectures from this course, because I think the psychological component of our courses, of this course, the psychological component of an exerciser, an athlete, is very, very important. And I think it's even more important sometimes than the physical, because they mesh so well that the psychological can affect the physical and vice versa. So we have to always stay on top of, well, why are we not exercising? So again, I really appreciate you all taking the time to listen to these lectures, and I hope that they've been informative for you, and I hope to hear from everybody soon. Have a great day.